In this episode of the Debunque podcast, we'll dive into the repercussions of President Donald Trump's sweeping cuts to USAID in Uganda. Let's hear some news headlines before we jump into our interview with a public health specialist in the country. Welcome to Debunque.
This is Democracy Now! Or the War and Peace Report. I'm Amy Goodman. The future of USAID, that's the U.S. Agency for International Development, is uncertain after Elon Musk said President Trump has agreed to shut it down. Reuters reported hundreds of USAID contractors were put on unpaid leave. Some were being terminated after Trump imposed a sweeping freeze on U.S. foreign aid. This is Democracy Now!, the War and Peace Report. I'm Amy Goodman. We continue to look at how the Trump administration's cuts to the U.S. Agency for International Development are likely to cause enormous human suffering, leading to increased death and disability, accelerated disease spread, political instability, and heightened threats to U.S. national security. That's according to internal USAID memos. One leaked memo has a chart for different program areas and the expected global case increase over 1 year if programs are permanently halted. For malaria, an additional 12.5 to 17.9 million cases, with up to 166,000 additional deaths each year. For tuberculosis, a 28 to 32% increase in estimated incidence globally. For Ebola, worst-case scenario, more than 28,000 cases. Polio, an additional 200,000 paralytic polio cases a year over the next decade. The memo also projects 1 million children will lose treatment for severe acute malnutrition each year.
The U.S. Supreme Court has upheld a ruling ordering the Trump administration to pay $2 billion in USAID contracts for work already completed. This comes after the U.S. government ended 90% of the agency's foreign contracts, halting development work right around the world. Former ambassador and former administrator for the USAID, Samantha Power, joins me now. Nice to see you, Ambassador. Appreciate making the time. The Trump administration has now terminated more than 10,000 foreign assistance contracts and grants. What is your sense of the impact this is having on developing nations?
How long do you have? There's really no words. I mean, it is repairs to Ukraine's energy grid. It is probably, the estimates are now 200,000 more cases of paralytic polio. There was an Ebola outbreak in Uganda that USAID was contributing to smothering, supporting the Ugandans who were doing the frontline work. And despite claims from the Trump White House that work is continuing, it's false. A team of 48 is down to 3. You can't do this work with 3 people.
Hi, everyone. My name is Bana Mwesige, and you are most welcome to the Debunk It podcast. Today we're having a very special guest, and I will let them introduce themselves.
Hello, everyone. My name is Andrew Tendo. I'm a medical personnel, also a public health specialist, and I work with Legends Rejuvenation Hub, where we offer healthy care services to the vulnerable and marginalized elderly and middle-aged persons, especially those in the key population community.
Thank you, Andrew. Thank you for joining us. So the topic for today basically is we're talking about HIV service provision in the light of the recent funding freeze and all these conversations around how we're going to move forward now that there has been a funding freeze from USAID and PEPFAR. I just want you to take us back and just let me know how has the situation been like before we go into the funding freeze, especially for key populations. How have they been receiving HIV services, and through what channels have they been receiving HIV services?
Just to note, the key populations in Uganda have over 60 DICs across the country, and these are responsible for helping them in easing access to HIV-related services like HIV treatment and adherence assistance, giving members or communities preventive services and bringing them closer to preventive services such as condoms, PrEP, PEP, HIV-related counseling, and STI treatment. So these DICs are widely spread, and they ease the work for the government by bringing the most at-risk population services. Remember, when you help the most at risk, you're helping the entire community. And that's what has been happening. And so just know when funding is let down, or anything around funding is let down, all those DICs are not supplied with essential aid to help their functioning take on, and it affects the government, but it also affects individuals at all levels.
Because you work on the community and on the ground, between the time of the freeze and now, what have you been hearing from the community with regards to the services? How are they feeling about accessing these services?
According to information I know and meetings I've attended, at least I know particularly to what extent our community has been affected. For example, according to the report that was recently released by UKPC, which is Uganda's Key Populations Consortium, at least 97% of KP-led organizations have been affected, and the effect has gone to 67% of CDC-funded projects. It comes from CDC, and then 33% of funding, which was coming from USAID, has also been affected. Among those which are those KPCSOs that have been helping run DICs for KP populations, 97% claim to be completely affected. In other words, their functioning has really almost totally ceased. So it means like a supply of condoms to sex workers has totally freezed, 97%, or even to men who have sex with men. 97% of those have completely closed down at giving services, and then 3% are partially affected. It means that even when you're not so dependent on the USAID funding or USA foreign funding, you would find that at least in some way you are affected. For example, the government of Uganda all throughout the country was dependent on USAID funded condoms. And even families where we have couples that are one is living positively and another one is living negatively, those couples are now affected. And they have been depending on PrEP, where the one who is living with HIV is using PrEP, and the one who is not is taking their ARVs. Currently, the provision for PrEP is out of the way because it has completely been funded by PEPFAR. Project PrEP has been funded by, and right now, the freeze of funding that doesn't care about diversity, inclusion, and equity has taken away such an item off the table. So it means people are going to increasingly suffer the consequences. So we expect a lot to change in people's lives. Infections to increase beyond what is measurable. And the UN target of the 2030 agenda, we are now uncertain whether it's going to come, like the 0 new infections. It's really quite uncertain whether
you'll be able to
we shall be able to achieve it.
You mentioned something around people not being able to access those products and services, but I want to understand the feelings at the facilities themselves, especially with regards to, key populations by the nature of being key populations, they are already stigmatized, because of their work or the things they do, or even generally just their appearance. Do you think the funding freeze and the inaccessibility of these services has made that worse? Are you hearing any stories or challenges from people with regards to stigma and because there's already a barrier to access, that there's no funding, but is the stigma made worse because of this situation?
So at the very announcement of the freezing, that was around 24th, where organizations started receiving information, 24th January, when organizations started receiving information from implementing partners that this should not be done, don't supply this, a lot of uncertainty took place. And one thing that the community depends on most are the peer educators. And in other settings, the community of the KPs depend on peer educators. But then in other settings, they are called the VHTs, village health teams. Those are the people that were first stripped of of payment. Because they were the ones that were so much into contact, they left their workplaces because they were funded directly by either PEPFAR, CDC, or directly by USAID. Now it means like a person who had made an appointment on a Tuesday to receive their medication with a peer, that peer would not go. This was an abrupt freeze. The peer you had made an appointment with didn't arrive. You get it? Some other health centers even completely closed immediately. So even those ones who had gone to the health centers to receive their ART or pre-fill, they found the clinics had already closed. And another thing that was so perturbing and disturbing was when they announced like this, some implementing partners sent out letters recalling even those items. Yes, for example, the bikes, the motorbikes, they recalled them. Bring back our motorbike, bring back our laptop. And you know what? Even if you would solicit funds from some other source apart from the USAID, already you wouldn't continue serving because even the element, maybe you would be able to get fuel to put into the bike, but even that one they said bring it back. We don't want you to use it to promote DEI, which Trump has freezed. We received a lot of calls from community members, from beneficiaries around the country, people living with HIV saying, is it now a death sentence? Promoters of the removal of DEI, majority of them also say they are pro-life. And we found that now the pro-life movement is saying, let people die by not getting care, treatment, and prevention of disease. So people were calling in and saying, are we now being sentenced to death? Because things that would protect masses from stigma, from mental health abuse, has been stripped off by sudden announcement. This thing is really annoying and it's absurd because it was abrupt. If at all the communities were prepared and given chances to adjust and leave this kind of funding gradually, maybe it would be better. But it was abrupt, immediate effect, and it really brought a lot of sadness in people's houses. People's health workers lost their jobs. So you'll find that someone who has been the breadwinner of the family, they lost their jobs. People that have been doing programming in different sectors, people who have been doing communications for these organizations, the aim and is you found that the entire country was put at stake. And the Ministry of Health and experts around the country, they announced like over 1,000 plus jobs had already been lost at the announcement. You see now the disaster. It's affecting the economy, individual pockets, families, children that are going to go to school. And every sector is affected just by a mere freeze on health sector.
In your view, do you think there are any long-term effects to the general health of key populations, but also Ugandans as a whole, because key populations live in Uganda, yeah? And also it's not only key populations who are at risk of getting HIV, even the general population is at risk of getting HIV. So do you think there are any health or long-term consequences for this funding freeze looking at in the future?
We expect that it's going to be a bit harder for the development of the cure against HIV, because again the research related projects are no longer having funds. The majority of those projects and researchers were funded by USAID, CDC. They were the top funders of such sectors. In as much as there are other funders, the top niche was the US foreign funding. So there is going to be decline or delays in getting things done. And that wasn't what was expected. We are expecting an increase in mental health issues because already just at the start of the freeze, mental health issues just got high. Even health workers got mental health issues. Even peers that have been counseling, the counselors in AIDS clinics, they all developed mental health issues. They didn't know what next, what is going to happen. So a lot of things happened there, and mental health is now at stake. Already the country was speaking about 70 and above of people are going to run crazy by 2025. Now that number has already been multiplied. We don't know how many are going to have mental health issues now, but everyone is in worry. Now, another certain thing that it's completely certain that we are going to have an increase in HIV-related cases. People are going to get HIV, and then they will develop AIDS, and there is not going to be standard statistics. How many women are being affected? How many key populations, community members are being affected? Which areas are we going to tackle to prevent? Because now even the present funding that is still there, the little that is still there, they have eliminated DEI. So that issue creates an issue around who is causing the most kind of infections, who is causing the most, who is contributing most, where should we tackle most. So the elimination of such kind of category in care is an indicator that one, public health is going to suffer a crisis of where do we tackle to prevent or to stop the spread. And at the end of the day, there is going to be an increase of HIV infections that are unregulated, undeterminable, and all the that can come. Yes. Then we're also going to have, Uganda has been boasting around 95% of individuals that are affected with HIV on treatment already. We are now looking at it in an angle that many are going to fall off treatment. Why? The adherence sessions that have been happening in DICs are no longer funded. The follow-ups that have been happening at facilities are no longer funded. So we expect that even the 95 that we've been thinking about is going to fall below that. And what happens there is the development of AIDS, and there is no direct alternative that has already been developed. Like you see, our government has tried to integrate services in clinics. Saying like, let's remove isolated HIV clinics and then integrate them with other services so that people continuously receive services. But like, even when that one is happening, the comprehensive care that a person living with HIV has been receiving is going to decrease. And before long, we shall lose count of how many people can get services.
Before we wrap up, what do you think CBOs, international partners, governments, people with access to resources and access to people in power, what do you think they can do to make sure that people at risk of getting HIV and those also living with HIV are supported during this challenging environment?
I think now it's time for us, people working with CBOs, CSOs, healthcare facilities, to rethink our strategies, localize service delivery, rethink of ways of sustainability that are a bit local, beyond funding. How do you make sure that you have a business backup for a CBO that is giving this service? How do these funding agents also help these CSOs localize service delivery, support locally made initiatives that are meant for sustainability of the CSOs, beyond facilitating soap making projects at CSOs, arts and craft, but accepting operations that are going to bring serious money, that is going to make the CSO stay running and continue to serve the target communities. That has not been what has been working. Our CSOs have always been independent, only fund-based, and that is not, now we see it's not working. If we still need them to work, we need to fund them to have more creative and sustainable funding beyond the funding periods. Ideally, very many funders are not intentional at giving this kind of support, and they say, make sure that it is sustainable beyond funding. And then sustainability most funders want to hear is, how are you integrating with government systems? You get it? And now here we are. The government is defunded. Even when we look for ways of adjusting and adapting all sustaining our work through government, it's not possible anymore because they also don't have the resources. So we are looking at each other. The government is looking at CSOs. How much can you mobilize and try to do this activity? We are also saying, how much can you offer currently? And everyone is looking at another and no one has a solution because our funders were not looking at us in terms of how we shall seriously move on and be able to sustain ourselves.
You as a medical personnel, but also for your fellow medical personnel, when you reach a point and you're working, you're not paid to do this, so you're no longer paid to to look after HIV clients because there's no funding. But also the burden is quite high now because now everyone is looking to the personnel to support them or to give them encouragement. So finally, as we wrap up, Is there anything you as a personnel you think you can do or you can advise other personnel to do to support key population individuals seeking services?
Last I saw is majority of facilities that are supporting KPs, much as funding has gone low, they are trying to find ways to keep on serving the key populations. And it is important that health workers that are having the goodwill look out for these CSOs, find ways of volunteering with them. But I know it's also hard when also health workers don't have ways of surviving now that they have lost their jobs. But those ones that still have jobs, they can really look out for them and try to support them. Offering a counseling session, saving the next victim of HIV, or saving the person who thought of death and is suicidal. Offering to go and maybe check them and make some prescriptions for them at a nearby CSO, offering them service is important. And organizations that are offering services are having their facilities still open. Proud Legends initiatives, Legends Rejuvenation Hub is open and operational. Any health worker that can give them a day of service to help older persons living with HIV and those ones that need preventive services and all those ones that are having a comorbidity of HIV and other non-communicable diseases require services. If you have a specialization in that and you can really do that, Legends Rejuvenation Hub, we are open and you can give us such a rendering. I encourage health workers, especially those who are KP leaning, to look for each other and find ways of solving issues. There is the Uganda Inclusive Healthy Care Forum that brings health workers that are KP leaning and also medical facilities to boost localization and continuity of work. So look for them, have a conversation, and let this be done. One thing I know of is health cannot be completely shut down, and even health and service provision cannot completely be shut down, because even with nothing, there is goodwill for individuals to do something. And if you're a good wheeler somewhere there, please come out and let yourself shine.
Thank you so much, Andrew. But before we close, where can we find you or because people have been hearing the Rejuvenation Hub and someone might be there and they're like, I want to get services or I want to reach out. So how can they reach out to you or to your work?
The Legends Rejuvenation Hub is really age specific. Individuals that are 35 years and above can reach out to the Legends Rejuvenation Hub for healthy services, which include NCD monitoring, NCD service delivery, counseling sessions for older persons, fitness and nutritional information for older persons, and geriatric healthy care for older persons, screening for cancer, screening for diabetes, hypertension. They are available for the Legends Rejuvenation Hub, and it is always open Monday to Friday. So those ones that really feel like those above 40 and they really need such a kind of geriatric approach, age-tailored service delivery, we are available. You could call me as an individual, or you can email. You can reach out proudlegends@gmail.com. You can visit our social media platforms and then maybe we can connect. We are on Twitter at Proud Legends Initiative.
And Instagram.
And Instagram, we are there. At TikTok, we are there as Legends Rejuvenation Hub. Yes, any platform, you just inbox and we reach out to you. And with a smile, give you the services that you need.
I've been Bana, your host. Have a lovely week, lovely day, lovely night. Thank you so much.
This was the Debunque podcast. Check out this episode description for more information. Thank you for listening.